Deciding to have a child can be an exciting time, but for between 10 to 15% of couples, it's frustrating, draining, and stressful because of infertility. Dr. Philip Werthman joins us to reveal some surprising causes of male infertility. Thanks so much for being here, Doc. I think most people understand that lifestyle can play an important role. So, for instance, if a male smokes, drinks alcohol, is obese, that can affect male fertility. But you say there's some surprising reasons.
The most common thing that I see in terms of causing male infertility is something called a varicocele, which is a varicose vein, just like people get in their legs. But this vein can happen anywhere in the body, and it's very common for men to have this vein around the testicle. So it's so common that about 20% of young men going into the Army on their induction physical exams have this diagnosed. And it's also the most common cause of what we call secondary infertility, meaning couples were able to have a child pretty easily early on, and as they get older, there was problems. And 80% of couples or men who have secondary infertility have this varicose vein. About half the couples who have this and have it repaired will be able to conceive naturally within the course of a year.
So that's a medical diagnosis
Yes.
that can be made and hopefully rectified.
Yes.
What else should men be aware of, and women, when it comes to male infertility?
Well, the most preventable cause of infertility is infection in the reproductive tract, kind of like an STD, or some men have undiagnosed prostate infections. As a matter of fact, they say that over the course of a man's lifetime, there's a 25% chance that he will develop inflammation or an infection in the prostate. So the reproductive plumbing, the tubes are really, really tiny. They're fractions of millimeters. And an infection or any kind of inflammation can cause a blockage, just like it can cause in a woman's fallopian tube.
Absolutely.
And that prevents the sperm from coming out. The other thing is when somebody has an infection, especially when it's an untreated and chronic infection, the body's immune system tries to fight off the infection. And the sperm end up being bystanders in this battle that get harmed.
So in both cases, that chronic inflammation is what causes scar tissue and narrows down the plumbing or the tubes,
Yes.
like
there
you
can be-
said, so it can't receive. Okay.
Yeah, and there can be other reasons too, but yes, yes, absolutely.
And one of the big surprising factors that causes infertility in men is taking testosterone. And the testosterone replacement and anti-aging market is booming right now. It's a multi-billion-dollar business. And men are waiting longer to have children, just like women are waiting longer to have children. And when they get into their 40s and 50s, they may be feeling a little sluggish or a little run down. They go to an anti-aging clinic, or they talk to their friends at the gym and they want to get a pick-me-up, and they start taking testosterone, and they have no clue that testosterone actually shuts down the body's sperm production.
Yeah.
So it increases your drive, but then you're firing blanks, as
That's
it
right.
were. Is that
One of the great ironies of life.
Yeah, right.
That's right. You have more energy, but you go bald and you fire blanks.
Yeah. All right. Less than ideal.
Less than
That's
ideal.
less than ideal.
And I'm glad you brought that up, because the presumption would be the opposite.
Yes.
And it's handed out like candy in many cases now.
I think that's the point, and I'm so glad you brought up that it is a male issue also, because I think the knee-jerk when people are having difficulty conceiving is always that it's the female problem, but obviously you're pointing out some really good reasons it might not be.
Well, Dr. Werthman, I want to thank you so much for highlighting some of these issues with male fertility. Really appreciate it.